Hello, my name is Jen Batchelder.
And my name is Aeri. We are dental hygiene students at Lake Washington Institute of Technology.
Today we are presenting Impartial Fulfillment of Research 2, a presentation on burnout in the dental field, risk factors and prevention. Abstract. Burnout is defined as a state of physical and mental collapse brought on by emotional exhaustion and chronic stress. Our research has shown that burnout in dentists and dental hygienists can lead to negative perceptions of oneself, depersonalization of patient care, and reduced personal accomplishment. If left unmanaged, burnout can eventually lead to poor health, addiction, depression, and suicide. In order to avoid these negative ramifications, a thorough review of risk factors through use of studies obtained from research databases, as well as advocacy of the data found, must be implemented. For dentists and dental hygienists, identifying the signs of stress-inducing factors and implementing prevention methods will help reduce the future risk of burnout during school and in the workplace.
Objectives. This research is to investigate the various signs of stress-inducing factors that can lead to burnout and identify preventative methods to reduce and avoid chronic stress. Methods. In an attempt to locate valid and reliable sources to further gain knowledge in our topic of interest, we went about our research using PubMed and LWTech library as our database of choice. Additionally, using mesh terms such as burnout, dental, dentist, dental hygienist, stress, causes, signs and risks, along with filtering our result to display only peer-reviewed articles and recent articles from 2010 to 2021, greatly increased the focus and specificity of our obtained sources. Result: upon evaluation of found sources, it is evident that there are significant stress-inducing factors that contribute to burnout found in a dental practitioner's work and school life. A study was recently conducted to identify occupational factors that can cause burnout among the California Dental Hygienists Association members. According to Bercasio et al., 1/3 of respondents of the CDHA experienced burnout. Other studies were also analyzed, and the data was then assessed to identify common signs of stress-inducing factors. Here are some common signs of stress-inducing factors. Lack of control and autonomy. Lack of control or autonomy in decision-making was the most common risk factor for stress reported. Working environment and conditions. Stress-inducing factors for dental hygienists due to working environment and conditions include job overload, poor physical environment, workplace where people complement each other, career opportunity, and work engagement. Lack of appreciation from management. Respondents of Bercasio's research who felt appreciated at work more frequently had less emotional exhaustion and less depersonalization. Crossover from a coworker. Crossover is the process that occurs when job strength transfers from one person to another in face-to-face contact. Exhaustion may cross over particularly from exhausted leading position like dentist to subordinate position like dental hygienist, on the conditions of positive and frequent collaborations. For ergonomics, one of the most common triggers of feeling stressed or musculoskeletal pain.
Identifying these common risk factors also led us to research preventative measures that can counter chronic stress and thus avoid burnout. While this concept of prevention is generally accepted amongst healthcare professionals, it does not mean it is implemented in their daily lives. A study that surveyed dental hygiene students showed that they had low mean scores of physical activity, stress management, nutrition, and health responsibility. This shows that advocacy and implementing self-care behaviors is continually needed. Prevention practices such as individual responsibility and self-assessment, holding oneself accountable for your overall health, which can include nutrition, physical activity, spiritual growth, meditation, and sleep patterns, can all aid in stress management. Self-care and planning. Having self-care goals which include implementation, evaluation, and self-reflection will result in life satisfaction, improved health status, and a general sense of well-being. Understanding and focusing on what you enjoy and practicing techniques of reframing and optimism when dealing with stressful school or work-related experiences. Advocating for assessments and resources within school and the workplace. Engaging in health promotion and seeking support of management, co-workers, and peers will further improve communication and create an environment of teamwork. Exercise and ergonomics. Physical activity is known to enhance your mood as well as your physical state. It promotes self-mastery, resilience when dealing with stress, and has an analgesic effect for physical pain while expending built-up nervous energy. It is important to plan breaks during work or school days, to go outside for a walk of fresh air, and to continually practice proper ergonomics while in the dental chair to avoid musculoskeletal pain. Conclusion. Dentists and dental hygienists can develop burnout due to common risk factors found in the workplace and during school. Our research has shown that these risks can be identified and prevented through individual responsibility, self-care and planning, advocating for assessment tools within the workplace and school, and exercise and proper ergonomics. If dentists and dental hygienists recognize these risk factors, they can prevent burnout, and the negative effects of mental exhaustion can be avoided in dentistry. 2 questions for our viewers.
First, prior to our presentation, were you aware of the signs of stress-inducing factors that contribute to chronic stress in the dental field? Second, how might burnout impact your dental hygiene career or your future patients?
This concludes our presentation on burnout in the dental field. Thank you.